Hi, my name is Erika, and my topic is abortions in the United States and Saudi Arabia. How this issue affects women the most. The practice of abortion, which is the termination of a pregnancy, has been practiced since ancient times. In 2005, the mortality rate for induced abortion was 0.6 deaths per 100,000 live births. For pregnancy associated mortality rates of women who delivered live neonates was 8.8 deaths per 100,000 live births. The procedure itself is very safe, with complications occurring in less than one-fourth of 1% of the time. Complications of abortion are about the same as a colonoscopy and less than having your wisdom teeth removed. If they if the procedure takes place in a doctor's office, a clinic, or a hospital, they are safe. Women face barriers outside of the procedure itself with increased travel time to clinics, longer waits for appointments, and greater costs of the procedure. Delaying or effectively blocking abortion care puts women's health at risk. The longer a woman waits to get an abortion, the higher the chance of complications and the higher the cost. Restrictions to abortion put a woman's physical and emotional safety at risk. Limited access to abortion makes it likely that self induced abortion will become more common. The United States and abortion. Although abortion is legal in the US, different states have different laws and restrictions. People who identify as pro choice believe women have the right to choose when and if they want to have children, based on their own practices and own beliefs. People who identify as pro life believe women should not be able to choose abortion under any circumstances. People who are pro life, also known as anti choice, along with abortion, feel that women should not be allowed to use birth control. Individual, interpersonal, societal, and organizational factors can affect the decision making of a woman to get an abortion. At the individual level, factors that can affect a woman's decision include their marital status, whether they were the victim of rape or incest, their economic independence, and their education level. Interpersonal factors include support from one's partner and parental support. Societal factors include social norms, religion, and the stigma of premarital sex. At the organizational level, the existence of sex education, the healthcare system, and abortion laws influence the decisions if and where to have an abortion. Abortions are legal in the US, but each state has more or less hurdles to jump through. For example, Alabama versus New Jersey. Now, in Alabama, abortion is illegal, unless the pregnancy will cause physical harm to the mother, versus in New Jersey, where there is no time limit nor any restrictions to get an abortion, unlike some other states. This is very rare because nearly every state has one abortion restriction. Abortion is such a huge topic in the US right now because since June 1st of 2019, about 26 abortion laws have been enacted in 12 different states, while many more are being introduced by state legislators. Yet state efforts to undermine abortion rights and access have been underway since the 1973 decision in Roe v. Wade. This is the ruling that started the pro-life and pro-choice debate. Despite the constitutional right to abortion, states have enacted more than 1,200 abortion restrictions in the past 46 years. Although some of these have been struck down by the courts, many of them are still in effect right now and require patients and providers to navigate a minefield of laws, regulations, and court decisions. Here's a map of the US, and it shows in color which states have which time restrictions. So each color is the amount of time that a woman has to get an abortion to label it as legal. Yellow is up to 20 weeks. Green is up to 24 weeks. Blue is at viability. Purple is more than 25 weeks. And gray is no limit. This is a picture of two maps of the US. The first map, which is in 2000, and the second map for 2019. The US states tightening laws on abortions. In 2019, 21 states are hostile or very hostile towards abortion rights. So in 2000, there's only 4 states that are even labeled as hostile, whereas in 2019, there's now 21 states that are either hostile or very hostile. The United States and abortion. Here are some important court dates for the most important court decisions that affect abortion rights. In 1967, Colorado is the first state to liberalize its abortion laws. In 1970, Alaska, Hawaii, New York, and Washington liberalized abortion laws, making abortion possible at the request of woman and her doctor. 1973, Roe v. Wade Supreme Court decision strikes down state laws that made abortion illegal. 1992, Planned Parenthood of Southeastern Pennsylvania v. Casey reaffirms the core holders of Roe v. Wade that women have the right to an abortion, but allows states to restrict abortion as long as these restrictions do not impose an undue burden on women seeking abortions. These are the two most important dates, 1973 and 1992, are the two most important court decisions that affect abortion today. Undue burden is defined as a substantial obstacle in the path of a woman seeking an abortion before the fetus attains viability. The question of this court case was, can a state require women who want an abortion to obtain informed consent? Wait 24 hours, if married, notify their husbands, and if minors, obtain parental consent without violating their right to abortion as guaranteed by Roe v. Wade. So basically they're saying, can we make women do all of these things, but they still have their right to an abortion? So the court case came down to a 5-4 vote, and it reaffirmed Roe v. Wade, but with the addition of the undue burden clause. And the only notification of the husband was the only part to fail the undue burden test. The rest passed. So, how views on abortion are split in the US. Percentages of US adults in 2018 who say abortion should be legal in all cases, 25%, legal in most cases, 34%, illegal in most cases, 22%, illegal in all cases, 15%, don't know or refuse to answer, 5%. Saudi Arabia and abortions. In Saudi Arabia, abortion is forbidden according to the interpretation of Islamic law. Abortion is only allowed if a medical committee agrees that the pregnancy is a danger to the physical or mental health of the mother. A pregnancy arising from incest or rape might qualify for a legal abortion under the mental health exemption. Abortion must be done in the first 40 days of pregnancy and only if it is deemed that the health of the mother is at risk. An abortion after 40 days must be approved by a licensed medical professional and only if he deems it necessary. Along with a committee agreeing, spousal authorization and parental authorization is required for a woman to receive an abortion. According to Dr. Gamandi, a specialist in obstetrics and gynecology in Saudi Arabia, no medic in the kingdom is allowed to perform an abortion before its case is evaluated by the religious committee. This doctor also explained that the most high percentage of abortions in the kingdom are often related to cases where a medical issue arises during the woman's pregnancy. For us to understand why their laws are the way they are, we have to understand their beliefs. The Islamic principles that relate to abortion are: take not life which Allah has made sacred. If a man kills a believer intentionally, his recompense is hell, to abide therein, meaning forever. Kill not your offspring for fear of poverty. It is we who provide for them and for you. Surely killing them is a great sin. And a mother should not be made to suffer because of her child. These help us understand why their laws are the way they are, and it helps us understand why they make an exception for when the fetus endangers the health and the well-being of the mother. Cultural similarities and differences. Some states in the US have stricter laws than in Saudi Arabia. Laws being passed in Alabama and Georgia are becoming more restrictive than the countries in the Middle East still under Islamic law. In new Alabama state law, just like in Saudi Arabia, there is an exception to save the life of the mother. In the new Alabama state law, unlike in Saudi Arabia, there is no exception for pregnancies that from incest or rape. The new Alabama state law, which was signed on May 15th by Alabama's Republican governor, Kay Ivey, he signed the most restrictive abortion law in America and one of the most restrictive ones in the Western world. It's aimed at doctors, but will affect all women who seeks abortion by making it a felony punishable by up to 99 years in prison. Ivy and the bill's supporters know that it's unconstitutional, but and it will be challenged in federal court. But they said that they passed it with the intention of taking the case to the Supreme Court, where they will fight and hope to overturn Roe v. Wade, the matter that legalized abortion in the US in 1973. So basically, he passed it knowing that it would be deemed unconstitutional in federal court with the intention of him taking it to the Supreme Court to try to get it overturned. Unlike the US, in Saudi Arabia, the government is a monarchy. The constitution is governed by a very strict interpretation of Islamic law. The Council of Ministers is nominated by the king. Policies are formulated and implemented by the government. Unlike in the US, the media is owned by the government. So in the US, social media is giving women more of a voice, where in Saudi Arabia, the media is saying what the government wants everyone to hear. In Saudi Arabia, women's health and well being are negatively affected by the local interpretation of Islamic laws and social norms. Ethical issues and considerations. Inequality exists in every society to a varying degree, and some societies more than others. In the US, there is still a gender pay gap, as opposed to in Saudi Arabia, where women are now allowed to drive cars, which for them is a huge step. Due to the extreme interpretations of Islamic law and social norms, women are the most negatively impacted individuals in Saudi Arabia. In the US, supporting women's rights makes you a feminist, while in Saudi Arabia, advocating for women's rights can lead to torture. The example that I'm referring to is in 2018, a long standing ban on women's driving was lifted in June. But while this was happening, authorities arrested activists who were campaigning for women's rights to drive. The activists that were arrested were accused of conspiring with other governments, and some were repeatedly tortured in custody. This crackdown was interpreted as the government who sought to discourage independent activism and did not want civil society to get any credit for any of the new passing reforms. Which means the government did not want activists thinking that they could take credit for the new reforms that were passing. I've also included a video that I thought was interesting about the fight for women's rights in Saudi Arabia. It's about 5 minutes, so I included the link below. In summary, abortion in the US and Saudi Arabia have some similarities, but also have some huge differences. Abortion is legal in all states with certain restrictions in certain states, while abortion is forbidden in Saudi Arabia with exceptions for a risk to the physical and mental health of a woman. In the US, advocating for women's rights makes you a strong feminist, while in Saudi Arabia, doing the same thing still makes you a strong feminist, but could get you arrested and tortured. Something that they do have in common is that both countries are advocating for women's rights and have no intention of stopping anytime soon. And this is my reference slide. Thank you.